My name is Nasty and of course you already know the time. Health Matter on top of your #1 family entertainment channel. We've been start off something last week. For those who've been joining us on the show, kudos to you. But for those who've been no join, we'll advise you make you go back on YouTube to go watch them, alright? Because this is not something we guys do with everybody, you know, talking about monkeypox. But who is limit? We want to talk about that when I get the expert himself in the building. Now he start now in field, and definitely you go to continue from where he stopped. So ladies and gentlemen, join me as we welcome we own in-house doctor. Yes, Dr. Barth himself on the show. Good morning, doctor. How are you doing? Good
Always
to see.
Looking cool,
Doctor,
calm,
this
and
one
calculated. Thank you.
Thank you very much, sir.
Yeah, thank you for that wonderful introduction. Good morning, viewers at home and around the world. Just like she rightly pointed out, we started a topic a week ago. What are we talking about? Monkeypox. Monkeypox. I'm going to give an overview. We'll talk about the latest in terms of the spread, the global spread, both within Africa and, of course, outside of Africa. Okay? But first, we'll start with a definition, give an overview, a little bit of history, signs and symptoms, how you can identify it when you see one around your environment, and, of course, transmission. How is it transmitted from one person to another? How did you originate? We are just smarting or probably trying to see what we can do with the global pandemic that the world is struggling to cope with, and yet we have another one emerging. Okay, so people are interested. They want to know a thing or two about monkeypox. Let me start by way of going down the history side of it. Monkeypox, what is it all about? Monkeypox is a zoonotic illness or a zoonotic disease. It's a viral zoonotic illness, usually very rare before now. But I can tell you, not anymore. Okay? So it's a zoonosis. What do I mean by that? Disease that can come from animals to man, or that can be transmitted from animals to man. Okay? And of course, it is a viral disease. The first case, the first time it was, history has it that the first time it was isolated was in the year 1958. However, it was within animal kingdom. Okay? Some monkeys that were kept for research were found to have pox-like disease. And of course, when research was carried out, they discovered, and of course, that was how the name monkeypox came to be, which WHO is trying to change for now because of some concerns in a number of quarters. It wasn't until 1970 when it was isolated in humans. So the first time it was isolated in humans was in the year 1970, and of course, it happened to be in an African nation. Congo DR was a country where an infant was said to have had pox-like disease, and of course, when research was carried out, they discovered that it was this disease that was previously seen in animals that has actually jumped to humans. And ever since then, I can tell you that it has been cases of sporadic epidemics of monkeypox in some parts of Africa, particularly the West African sub-region and, of course, the Central Africa. Okay, and of course, there are two definitive or distinct strains, or clade, if you like. The Central African clade as well as the West African clade are the two strains that are commonly found. A number of countries of the world today are battling with the the West African strain. Okay, but I will come to that. As of today, about 8,238 cases have been confirmed on a global level.
2000.
Yes, 8,238 cases have been confirmed globally, and that does not include West Africa and Central Africa. Only South Africa was captured in this. Now, out of this figure, let me come back a little bit to what we have in our environment in Nigeria. Okay, so NCDC has come out to say that so far, Nigeria has confirmed 84 monkeypox cases. Okay, from the beginning of the year, we have, as of the last time it was reported, week 26, the figures I have here shows that the NCDC, in its latest monkeypox situation report for week 26, added that no fewer than 245 suspected cases of the disease have been reported in the country. And these are the states where you can find these cases so far. There were 41 suspected cases reported in week 26 situation report. Between June 27th to July 3, 2022. And these states in Nigeria are about 20. Nasarawa had 6, Lagos had 4, Delta 4, Adamawa 3, Ondo 3, Borno 2, Ebonyi 2, Edo 2, Kwara 2, Oyo 2, Taraba 2, Akwa Ibom 1, Cross River 1, Benue 1, FCT 1, Kano 1, Kebbi 1, Ogun State 1, Plateau and Rivers also had 1. This is about what it is in Nigeria. But there is a global concern about monkeypox at the moment. Previously, what we were used to were sporadic cases in places where they were known to be endemic. So the world was more or less not too bothered, in quotes now, until it now started ravaging the Western world, and of course, Europe has its own biggest share at the moment. What has happened before now, what we were used to are cases that were spotted from regions where it was known to be endemic, some parts of West Africa, Nigeria inclusive, to the rest of the world. But the new wave that we have now actually originated from the Western world, among people who had no travel history whatsoever with West African country or African regions where this disease has been known to be endemic over the years. And I can tell you that with the report I have here on a global level from the CDC, that's my source, Europe, the rest of the world, including South Africa, has confirmed 8,238 cases. And these are some notable countries that have the highest of the figures. Germany has 1,490. Netherlands has 402. France has 721 confirmed cases. Spain has 1,256 confirmed cases. And of course, United Kingdom has 1,552 confirmed cases. Okay, that is the latest report from US CDC. Okay, so you can see that there's a global concern about this. And I want to also point out that this disease is predominantly found in a group of, in a particular group in the population, people who are sexually exposed to men. Okay, men who are sexually exposed to men. These are the population, the global population where this latest outbreak is actually or emanated. And these are people who had no travel records whatsoever with countries where monkeypox has been known to be endemic. And what that means is that there is now a sexual connotation to the spread. Okay, so that takes us to transmission. How does it spread? Some of the lesions are now being found on some people's genitalia. Okay, so we know that it could be transmitted from animals to man, and of course, from man to man. Okay, through close contact, which could come in form of breaks or wounds on the skins of individuals who are infected. When you come in close contact with such individuals, you can actually get the disease. Monkeypox has a lot of similarities with smallpox, which has been eradicated in the world as far back as 1980. That was 42 years ago. Okay, so they have a lot of similarities. Though the causative viral organisms are different, but their presentation are similar in a number of ways. And of course, observational studies have actually shown that the vaccine that was previously used in containing smallpox have about 85% efficacy. Okay, so it can still be applied today to good benefit. Okay, so that is some good news coming from some quarters. Now, in terms of transmission, how is it transmitted? But before we go to transmission, let's talk about the signs and symptoms. Of course, WHO Science in 5 also said we should stay safe, we should stay healthy, and of course, stick with science. Yeah. Okay, so that is very important, and that is why we're talking science this morning. Okay, now, still talking about how monkeypox emerged in Africa, I came across, because I must acknowledge that we don't have, we have paucity of data in this part of the world, but I try to see, to have an overview of what the spread has been from when it was first isolated in that little child in Congo DR in 1970. And this was what I came across. With respect to the two clades, okay, the Central African clade, which is known to be the most virulent, and of course, the West African clade, which we have in Nigeria, okay. Between 1970 and 1979, 38 cases were isolated in Central Africa. That's for the Central African clade, while for that of West Africa, between these years, only 9 cases were isolated. Between 1980 to 1989, 355 cases, suspected cases, were seen, talking about the strain of Central Africa. Within that same period, only 1 was seen with the West African strain. Between 1990 to 1999, 520 suspected cases of Central African clade were seen in Africa. And between that same period of time, none was seen for the second variant, which is the West African clade. Between the year 2000 and 2009, 10,027 suspected cases were seen with the strain of Central Africa. And within this same period of time, only 47 suspected cases were seen with the West African strain or clade.
Okay,
yeah. Glory from Rivers, good morning.
Morning.
How are you today?
I'm fine, good morning.
Yeah, good to have you.
Please go on with your question. Hello, Glory.
Good morning.
Good morning. Please proceed. Go on. We can hear you.
Okay. I've seen what they posted on what the doctor is saying about monkeypox.
Yeah.
But I really want to know more about it. Okay. I really want to know more about the monkeypox, how it's being spread, because in River State, they were not having any issue about monkeypox here in River State. So I really want to know how it's, I've not seen it, but the picture online on the TV, I've seen it. But we don't have any cases here in River State. So in case, like, the doctor says something about.
Okay.
Thank you very much. Thank you very much. The latest report we have from NCDC showed that this year, or in recent time, a case has been identified. A confirmed case has been identified in Rivers State. Okay. Let me also point out that 3 deaths have occurred from these suspected cases that were discovered in Africa, and of course that country happens to be our own Nigeria. Wow. Okay, so we have recorded 3 deaths. 3 people have succumbed. So you can see that this disease kills. But she wants to know how it is spread. Yeah. Okay, so that takes us to transmission. Now, monkeypox, like we have had, can be transmitted from an infected animal to an individual. And it can be from man now, it could be transmitted from person to person, usually through respiratory droplets, through skin wounds that you may have, an infected person may have in skin. Don't forget, one of the significant symptom that it presents with is that unique rash that oftentimes forms crust, comes with vesicle. I'm going to talk about that, more of that. And of course, the lymph node. Now, with that, you could have multiple wounds all over, septic spots all over such an individual. And these are potential sources, open wounds, from which it can spread from one person to the other. Even beddings where such an individual, an infected person could lie, such beddings can actually transmit the disease from one person to the other. But you must be, after you have stayed within that environment for a prolonged period of time. Okay? It can also be transmitted from mother to an unborn baby in what is known as vertical transmission, or from mothers to their newborns that are being breastfed. Okay, so sexual transmission has been reported in a number of cases, but ongoing research are still ongoing along these lines. Okay, but what we do know is that people who have lesions, that's wounds, around their genitalia, okay, can actually transmit it sexually from one individual to the other. So these are some of the routes through which it can be passed on from one person to another. Thank you very much. So now back to the figures that I was reading out before that question came in. So from the year 2009 to year 2019, for the West African, for the Central African variant, we have 18,788 suspected cases. While for the West African variant, we have 195 over this period of time. Don't forget, in 2017, Nigeria actually had what today stands as the biggest outbreak of monkeypox that we have had since it was discovered. Let me also point out that in the year 2003, about 70 cases were reported in the US, of all places. And these cases were actually passed on to US from some rodents, animals that were taken from Ghana, okay, a West African country, to the US. It affected about 70 people were affected, but none of them died at that time. But today we have monkeypox spreading like a wildfire. A friend of mine said something that was the science the world neglected that is beginning to come back to. I don't want to complete that statement, okay? So, but now, concerted effort is ongoing at the global level. So, of course, to support countries in areas of increasing surveillance, in areas of diagnostics, in areas of clinical management, as well as damage limitation, community engagement. Everything is on the table at this moment. WHO has said to cover for the inequality that exists in diagnostics and reported that they would not, they've started to report the global picture with that is happening in Africa. No longer going to be reported independently. They're now being reported so that the world can have a view, a clear view of the monster that is emerging, a new monster that is emerging. That if it is not tamed on time, it could cause a lot of issues for us on a global level.
Getting necessary attention
yes, of course it is. In the last 1 week, the WHO actually said that there was 77% increment just in 1 week. Wow. Okay, so the fear of monkeypox is now the beginning of wisdom. Okay, so every nation of the world is worried. So far, it has affected how many countries?
The US is
yes.
affected. Something. Then Nigeria.
Close to 60 countries of the world, yes, have been affected as of this time. And of course, the figure is getting to 8,500 suspected, confirmed cases, not suspected. Specifically, 8,238 cases on a global level as of July 3rd. Okay, these figures are coming from CDC. Okay, so we need to know about. Now, let's do more of signs and symptoms of this monkeypox. It comes with a unique rash that I've said, which could start as flattened rash, which in medicine we refer to them as marcos. And of course, after that, it could go from marcos to papules, usually raised rash on the skin. And after that, it goes in a sequential order. It could now progress to vesicles that will have clear fluid, rash that will contain fluid on our skin, on the skin of an infected person anyway. Okay, so after that, it progresses to the next stage, which could be pustules, rash, raised, contains fluid as well. But this time around, it could be pus. Suffice also to point out that the incubation period is between 5 to 21 days. The sickness can last between 2 weeks to about 4 weeks in all. Okay. Let me also point out that it's a self-limiting disease. It's a self-limiting disease, meaning that sometimes it could go on its own. even without treatment. But the treatment, as of now, the treatment is mainly symptomatic, supportive. Okay, if you have headache, you tackle it. If you have symptoms of vomiting or whatever, you tackle it. Okay, so, but that we're not talking about treatment now. Okay, so these are some of the things. After you have the pustules coming up, it could now end up with ulcerated lesions, rash, or crust. That is typical, that sometimes you see, and this can occur in hundreds all over the skin, usually more prominent on the face of the individuals that have them, and it leaves behind permanent scarring. Okay, so you can imagine the degree of damage.
Chicken pox, because I know it down also leaves.
Yes,
a permanent
it's similar to chicken pox and all other rash-causing illnesses. Okay, but something distinguishes it from some of those ones, and of course, that is the fact that, number one, it comes with swollen lymph nodes. It comes with swollen lymph nodes. So that distinguishes it from some other rash-causing illnesses that you have. Okay? Like I said at the beginning, is related to smallpox, which has been eradicated since the year 1980.
42 years.
42 years ago. And people who were fortunate to be vaccinated at that time, the older age group, not the younger ones like.
But doctor, if that vaccine could work, can't we, I don't know, is it not applicable now? Can't we have it now? So,
yes, there are stockpiles of the vaccines available, but not equitably distributed to places where you actually need them. Okay, so what is happening in Western world now is what they call ring vaccination. The population that is spreading, they probably will go there, people who are at high risk of picking it, and then they could vaccinate those people, as well as pre and post exposure. Okay, so the vaccine is available, but it is not equitably distributed. Also, when we get to treatment, I will talk about the newer agents, the drugs that actually be found that could be helpful, in tackling this. Okay, so in terms of symptoms, it could occur with rash. We have spoken about that. It could occur with swollen lymph nodes. It could occur with headache, fever, exhaustion, muscle aches, chills, muscular pains, and what have you. Okay, so we've talked about the transmission, and let's talk about the diagnosis. How is the diagnosis of this disease made? Okay, so oftentimes, I must also point out that it is usually a difficult diagnosis to make. We have John. Good morning, Mr. John. Are you there?
Hello, John. John, Mr. John. I think he's gone. He's gone.
Yeah, thank you very much. So it's usually a difficult diagnosis to make, okay, because there are a number of disease conditions that could present in similar ways, okay. But what, like I said at the beginning, high index of suspicion is needed, okay. So for anybody, because of the widespread, the outbreaks that we're having here and there, anybody that is having anything along that line, anything that is skin lesion, monkeypox should be up on your list, okay, of the diseases that you need to consider if you're coming in contact with individuals that have these conditions. It's not like we're not talking about things that we are not familiar with. I saw a case in my own facility about 2 months ago. I talked about that last week. Okay, so it was so it was so clear. Good morning,
Mr. King.
From Abuja. How are you today?
I'm fine, and you?
I'm good. Thank you very much for calling in.
All right. Two people are talking about this monkeypox.
Monkeypox.
Yes.
Yeah. What is the solution to all these problems on this planet Earth? We heard about Ebola. We heard about so many diseases. So what do we do to eradicate them? Thank you.
Thank you very much. Thank you very much for that very important, but I must also be quick to add, difficult question to answer. What can we do to eradicate them? What we can do to eradicate them will have to do with what the world wants to do. What the world wants to do. And of course, WHO is our lead. okay, is our pathfinder in this area. Okay, so eradicating them will require concerted efforts, not just from WHO, from national governments, bodies that have something to do with health, non-governmental organizations, health practitioners, everybody. It must require a collective effort. How is the diagnosis made? And of course, I started by saying that high index of suspicion is required among healthcare practitioners. Of course, everybody, because it's widespread now in a number of places. We have known monkeypox for what it is in the last few decades. Okay, but now the goalpost has changed, more or less. The epicenter now for monkeypox is no longer Africa. It is now Europe. Yes, and that is a fact. Okay, so just like the DG of WHO said, the spread is unusual and concerning. It's unusual and it's concerning and it's spreading like a wildfire. Okay, but what that teaches us, the experience that we're going to take from that is WHO and of course the developed countries of the world need to do more to ensure that treatment, vaccines are evenly and equitably distributed. So that will help to keep the world, the entire world safe, not just a particular region. And this brings me to the fact that for COVID-19 vaccination, the records I have shows that Africa as a whole, as of now, our level of vaccination is at about 18.4% in Africa. That's for COVID-19. But in developed countries of the world, in Western world, is about 74.8%. Wow. So we are usually left behind. Okay, so that shouldn't happen with this monkeypox anymore, because it has been a battle that we've been fighting all alone. Okay, so now that the global community are joining us, we are hoping that something significant, something different, a permanent treatment can be found. As it is now, there is no treatment. It's only supportive treatment, but there are some newer drugs which we are still going to talk about. So in terms of diagnosis, I did say earlier that it is usually difficult to make the diagnosis. Okay, but there are some tests that can be done. Samples can be taken from the lesions where you have those skin septic spots that occurred as a result of monkeypox infection. Fluid can be taken there and sent for PCR, for center, special lab where that can be done. Polymerase chain reaction is actually the gold standard for detecting the smallpox. Okay, so that's why you usually hear suspected cases, confirmed cases. It's only when a diagnosis that has been confirmed that you now know that truly this is the picture. In terms of treatment, what can be done? There are vaccines that we have said that was previously used for smallpox. Observational studies have shown that it's about 85% efficient even for those monkeypox. Okay, so that's some good news. A number of our new agents, treatment agents, have also been developed. Okay, Cidofovir is one agent that has been developed and licensed, as well as Tecovirimat. Okay, so these two agents can actually add to the treatment regimen that are already on the table. Okay, but keep in mind that the mainstay of treatment is usually supportive. Okay, depending on what the patient is presenting with. So efforts should focus more on what we can do to prevent it from spreading and what we can do to stop further spread of the disease. Okay, so efforts should hover on prevention. And that, of course, is why we are here today to talk to you about the signs and symptoms, so that when you see one, you can actually notice it on time and then take good measures. We do know that people who were previously, or science has told us that people who were previously immunized, vaccinated against smallpox, if they do get the disease, it will be the milder form. Okay, if they do get the disease, it will be the milder form. Some people have also insinuated that if you have a relation that is stricken with this disease, that is always better to allow the older age group who probably must have been vaccinated with smallpox vaccine when it was available, should be allowed to cater for this, that those people are more likely to stay protected and not pick the disease. And we also said that the disease is self-limiting. What that means is that with or without treatment, it could actually go on its own. But not when you have lesions and symptoms that can actually necessitate hospitalization. Okay, so the mainstay of treatment is supportive. So if you have anybody around you that is presenting with rash, don't just conclude that this is chickenpox, that this is measles. Please, this is a time to take such an individual to a healthcare center where such an individual could be properly and expertly evaluated. Okay, some of the things that we need to look out for, okay, for the monkeypox, we have said if you have somebody who has an unusual rash, somebody who has swollen lymph nodes, usually found on some region of the body, the areas around the neck, areas around the armpit. Okay, so such lymph nodes could be swollen in people who have monkeypox. That's one of the diagnostic features that can actually differentiate monkeypox from all other rash-causing illnesses like measles and chickenpox. You asked that question a while back. Okay, so now you have the answer.
Thank you, sir.
So overall, what we need to do is to pay more attention on prevention. Yes, the vaccine has been muted, that the vaccine could be, but I doubt if we have any vaccine in a number of countries of Africa where this disease are known to be endemic, over the years. But like I said, the new wave, the epicenter is no longer African sub-region, is no longer Central and Western Africa. It is now in Europe. And we are hoping, and we are also expectant that much can be done to stop the spread. The world has seen so much of this disease erupting in one country, another one erupting in another one,
like
and of course,
finish one, another one comes up.
You had the question that that gentleman asked, how can it be eradicated? The only one we know that has been eradicated is actually smallpox. It has been eradicated since 1980. So smallpox caused by variola virus is no longer, it can be found naturally occurring in any part of the world. But
so that means this also can happen if we collectively make it happen. Yes,
if good efforts, of course, if smallpox, which was more deadly, had more was more, the fatality rate was far higher than what we have with, of course, the monkeypox that we are talking about. Even among the strains, the two strains, the West African clade or variant is known to be less virulent than the Central African one. Fortunately for the world, the one that appears to be in circulation in Europe happens to be the less virulent one, the strain that is coming from, that originally was isolated in West Africa. Okay, but that of Central Africa, the one found in Congo DR and a number of other African countries, is said to be much more virulent. And there's only one country in Africa today that has those two clades. And of course, that is Cameroon. I mentioned that last week. They have both the Central African clade or variant or strain, if you like, as well as the West African strain or variant. Okay, so.
Doctor, would you advise that we stop eating all of this bush meat, monkey meat, and all of that? Because seriously, like what the caller said, most of these things are coming from animals. And it's like in this part of the world, we can't do without eating that. So I don't know, what would your advice be, especially for people that are in the village, you know, where most of the farmers, that's like where they get their incomes from?
It's a difficult call to make, okay, because I tell you, times are hard. You can say that avoid bushmeat, but the people you're talking to, will they adhere to salt? Because that appears to be one of their major sources of food. Okay, so, but this is a time that we need to avoid as much as possible bushmeat. Okay, so it's not yet known. It's not yet clearly known. The natural reservoir in terms of animals, okay, it was first found in monkeys, yes, but all other rodents have been implicated. So it's not yet known the exact natural reservoir for monkeypox. Okay, so this is the time to avoid bushmeat.
We'll do our part. Okay, we'll keep talking about it. So we are starting something new, right? Oh, Doctor. Yes. Okay. So thank you so much, everybody. Will be joining us on the show today. Dr. Barth hopefully will be here again next week, Saturday. We love you guys.
So do please join us next week.
Join us again next week and have a fabulous holiday.